both live on Facebook and YouTube. So I'm trying to set up my Facebook live. So everybody give me time. Let's see how it goes today. So this is 2 stands. Let's see who's live. Hello, everybody. So I'm trying to set up both cameras for both my Facebook and YouTube. Let's see who is live today. Okay, I think we're ready. So it's live. We are live both on Facebook and also on YouTube. So I'm going to be taking questions on Facebook and YouTube. So depending on which part of which question, which area I'm getting questions from. All right. Hello everyone, and how are we doing? I really missed coming live on social media, and I miss like saying hello to my followers. Yeah, so I decided to come live today. Let's see how many people are going to be online. And the goal is to actually stay up to 1 hour online. But if circumstances warrant it, I might not be able to stay up to 1 hour. Okay. So this is Nurse Mercenary immediately after childbirth. So if you notice for some time, like when I was pregnant, whenever I come online, I'm always feeling very tired, very exhausted. Like it was a lot. And most times I was coming live on my bed. Most people don't really know why I was coming live on my bed. I was always on bed during my live videos. I was unable to come live. I was unable to sit down on this chair for long. Like I just wanted to be on bed. So and I wanted to come live. So all those tiredness that everybody was saying then, all those I'm tired, all those, oh, I can't keep up, all those we are not showing up, all of that were as a result of being pregnant. Yeah. But now we have delivered successfully. Our baby is fine and everybody is fine. And we are back. So today it's more or less like my shoot day. I decided to shoot late at night today because I knew when my child usually sleep longer. Once it's 12:01, he's awake to do his normal meetings. You understand? Their eyes are very open. So I decided to utilize this time to come on live today to say hello to everybody and also take your questions as much as I can. We just finished shooting. We shot some videos today, some interesting videos, and I am done. And I decided to say hello to everyone. So I'm going to be calling out names of those that say hello. I think all my Facebook fans are asleep. So let me, we have Abiyan Lady. Hi, how are you doing? Judith Uchechi. Good day, ma. Good day, how are you doing? Sharon, how are you doing? And trust you are doing great. Gellison Lot, how are you doing? Akim Gordon, how are you doing? Augustine, how are you doing? Flomo, how are you doing? And also Habuma Global, hello, and how are you doing? Trust you all are doing great. For my Facebook, I am having nobody around, but for my YouTube, as usual, the YouTube always overpower the Facebook. So I am here to take as much questions as I can, and I'm also here to say hello to everyone. You can send in your congratulatory message. Yes, you can also send your congratulatory message. I appreciate. So it's the live on two. Hello, Priscilla Elaka. How are you doing? Trust you're doing great and trust you are having a nice time. So we just finished shooting videos for the week and I decided to say hello to everybody today. So how is it going over there? Let's keep the comments coming. Let's keep the questions coming as I'll be here to take them. All right. I'm here. I'm here for you. I'm here for everybody today. So let's keep it coming. So today, I think my videos today that I shot today were majorly focused on circumcision, like circumcision in the UK, the cost of circumcising a baby in the UK, the aftercare. And I also made a video on the bleeding after childbirth. I made a video on this. So before I actually made a video, I've made a video on some topics that are related, but I made it as a midwife. That's I made some videos as like with my knowledge of midwifery. But the videos I made this past week, so that was last week and today, These videos are actually based on not just my midwifery experience, but also personal experience as a pregnant woman and also as a mom. As a mom, yeah. So I've been able to merge theory and practical aspects, like not just the theoretical aspects of childcare. I've been able to merge the theory aspect and also the personal experience. So there's one thing to teach about a particular topic. There's also another thing to have a personal experience. So mending your theoretical knowledge and also your personal experience kind of make the whole knowledge more richer, kind of make the information more informative. So you're going to be getting more videos from me. I think we uploaded one video today, and that video was talking about vaccinations. It was talking about vaccination in UK and also in Nigeria, like the different types of vaccinations that they have all over. Like the vaccinations in UK are different. They are very, very different from the ones we receive in Nigeria as a pregnant woman. So I made that video and that was uploaded. So you're going to be getting more videos in regards to stress in pregnancy, how it can impact your baby on the long run. So if you are a pregnant woman, try as much as possible to reduce the amount of stress you experience or you encounter when pregnant. So that video is going to be dropping soon. I think next tomorrow, you're going to be getting that video. Then we made a video on exercise in pregnancy because during my pregnancy, I was actually doing the treadmill. Yeah, I was running on the treadmill when I was 38 weeks pregnant. I don't say you should do that. It's more or less like what I wanted to do, but it was not on a high speed. It was on a very, very, very low speed, very, very low speed I was running on. So I talked about the importance of exercise, and those videos are going to be dropping soon. Then I have made a video on how postino 2 can fail. Those videos I made while I was postino 2 sometimes fail. So I've made a video on that. Then those videos are going to be dropping soon, hopefully. So just stay tuned on the channel. We hope to drop more educative videos on the channel. We are back. We are fully back. We are fully back with our health content. We are fully back to taking your questions. So once the video is up, when you ask your questions, within 24 hours of asking those questions, you tend to receive answers. Yes, on all our new videos. On all our new videos. So if you have any question, the trick is to drop those questions on any of our new video because you're definitely going to be receiving answers as soon as possible. Okay, so that is it. So congratulations on your newborn. Good to see you back. Thank you very much, Steve Ford. Yeah, thank you very much, Steve Ford. So I have also made a video on how to conceive a male child. So for those that are looking for a male child, I advise you look forward to watching those videos because those videos are very educational. Those tips actually helped me have a male child after a female child. So I would advise you watch that video, get useful information. They ask as much questions as you want. All right. So we have Momodu Sidikat on Facebook. Hello, Momodu. How are you doing? And trust you are having a beautiful day. Trust you're having a wonderful day. So we have a question on our YouTube channel, and it says, "Nurse, please, is injection advisable for treating malaria in less than a year babies? Many thanks for your contributions to humanity." You're welcome. So I think it all depends on the severity of the malaria. It depends on the severity of the malaria. That is why I will always advise you speak with a doctor, not the roadside pharmacist. Seriously, because the health of your baby is very important. When it comes to treating malaria, any of those diseases, any of those sicknesses, it's advisable you speak with a doctor, not the roadside pharmacist. Especially roadside pharmacies that don't really have the knowledge of what medications is about. Okay. Yes, back home, there are some pharmacies that are well experienced, that are well exposed with the medicine and they've treated, but it's advisable you speak with those that are knowledgeable. So it depends on the severity of the malaria and how far it has gone. The doctors might prescribe some medications to get it treated out. Okay. So when it comes to injections are not just mere injections, they have different names. That's one thing you should know. Injections have different names. So I heard people say, no, they gave injections, but what is the name of the injection? What is the kind of treatment given to the child? Okay, so if needed, definitely the doctors are going to give the child that injection. So the injection definitely is going to have a name. That's one thing you should know. Okay. So we have Millicent Edro is watching. We have Momodu is watching. We have Uchibike is watching. Hello, everybody, and how are you all doing? Great, doing. Trust you are all doing fine. Okay. So I have a lot of content in stock for you. So this is the time for you to ask as much questions as you want. If you want me to shoot a particular topic, this is the time for you to drop it, because I am drafting a lot of content right now that will be short as soon as possible, because we are trying our best to answer a lot of questions. We missed a lot of questions last year. We were unable to catch up with the questions because I was pregnant. I was unable to answer a lot of questions last year. I was having a lot of appointments were here. A lot of my appointments were cancelled last year. A lot of my engagements were cancelled last year. I could not meet up with engagements. I could not meet up with my conferences here in UK. Like, it was really heartbroken, especially when I actually worked so hard to attend I really worked so hard to get a spot for a particular conference here in the UK. So after working so hard for that spot for that particular conference in the UK, like, I got the invite, I got everything prepared for the conference. Symptoms. First trimester actually dealt with me. Like, it broke me. I was not vomiting, but I battled with dizziness. I was really, really dizzy. Like, I could practically not do anything. So my pregnancy wasn't really a straightforward pregnancy. Yeah, it was straightforward with no serious complications, I would say. But I had things that just made me want to lay on bed. I don't want to do anything. I don't want to go anywhere. I was really feeling dizzy. I battled with low hemoglobin level, despite taking food rich in iron. Yeah, I had to go on. I had to take this Ferrojet. I had to take this iron infusion to boost my iron level. Yes, Nurse Mesme had to take the iron infusion to boost her iron level. So it was a whole lot, but thank God everything went well. So please, it's been a lot of talking from Nurse Mesme. Feel free to drop your questions. Like I earlier said, I'm here to take them. Let's see who we have here. Let's see. So we are not having a lot of people today online, but it's fine. We're going to come back. We are going to take more questions. I believe a lot of people feel we are not back yet. So that's why we are not having a lot of people at the moment. But we're coming back. We're coming back bigger. We're coming back stronger. We are coming back more effective. We are coming back to take your questions as much as we can. All right. We are here. We are definitely here for everybody. So I've answered Habuma Global. So I still have a lot of time. So I'm online. So I'm going to take as much questions as I can. So if there is no questions, you guys will just see me online here. Valentine is coming. Where is your boyfriend? Valentine is coming. Where is your girlfriend? Valentine is coming. Where is your partner? Valentine is coming. Where is your husband? Valentine is coming. Where is your wife? It's Valentine period, and I hope you are already planning to get your loved ones gift. I think, like, when it comes to Valentine, it's every day should be Valentine. I'm not really somebody that takes those special days very, very seriously. I just feel it's a normal day. I just feel every day should be Valentine. Yeah. Not like every day. You don't have to wait for Valentine to actually show your partner, your husband, your wife how special they are to you. Okay? You don't have to wait till Valentine. Thank you very much, City Cat. Momodu, yeah, we're back. We're fully back. Thank you very much. I really appreciate you. Then Steve Ford said, yes, I know, and my birthday. Wow! You were born on the love day of the month, or you the love day of the year. You were born that day. That's great. That's wonderful to know, Steve Ford. Happy birthday in advance, and happy Valentine's Day in advance. Hope you're planning to celebrate your birthday alongside with the Valentine's Day with your Nigeria partner, because I know you have a Nigeria partner. I hope the celebration goes well. Oh, it's 15. 15th of February. Okay, happy birthday on the 15th. So we are wishing you happy birthday in advance. Yeah, in advance. We're wishing you happy birthday in advance. Hello, Claudine Galacio Galendez. How are you doing? Trust you are doing great and hope you're having a nice time. It's nice seeing all of you on the live. So, like Ella said, I'm still here. So we're here to take your questions if there is any. I think most of the questions are already answered on our videos. Yeah, we've answered a lot of questions on our videos. So Amazing Grace TV said, Nurse, you they enjoy. I'm having sleepless night too. Where's the enjoyment coming from? I'm having sleepless night at the moment now because my night shift. Personally, how I'm able to deal with childcare now is that my night shift starts. Then my husband does the day shift. I do the night shift. No, it's not work. I'm not back to work. I'm just online. No, no, no. I'm taking 1 year maternity leave. I'm not back to work. So I'm going to be at home for 1 year taking care of my child. So I'm entitled to 1 year maternity leave. So I'm going to take my 1 full year maternity leave. So I'm not going back to work anytime soon. So I have like till December/January, I'll be back to work. December or January, I should be back to work. December or January, I should be back to work, but not anytime soon. So that's it. December, January, I should be back to work. Amazing Grace TV, do you know any hospital that do IVF there or Niger? When it comes to IVF, we have a lot of hospitals in Lagos, especially. Then a friend of mine actually did hers in Edo State. A very close friend of mine did her IVF in Edo State in a town called Uromi. For those that are familiar with Edo State, is in around the East Sound Southeast. Is it South Southeast? That area, yeah. Uromi, in a town called Uromi. That was where she did her in vitro fertilization. The first one, I think it failed. Then the second one actually worked and she gave birth to triplets. So that's the one I know because it's a friend of mine that actually did that. The first attempt failed, the second attempt worked, and it was a triplet. She gave birth to 2 girls and 1 boy. A very good friend of mine. So in terms of in Lagos, we have a lot of IVF centers in Lagos that one can contact. You can actually search online and they give you. So he said, I need that one. The fact is, I've not been able to. I think, Amazing Grace, you've messaged me before on my WhatsApp. I think you did message me on my WhatsApp before and you asked for it. I just have a flashback. I think we have a conversation about this IVF on my WhatsApp. Please send me a WhatsApp message if you have sent me a WhatsApp message before. I'm back and I'll try as much as possible to get across to that my friend to give me the contact so you can contact them. Okay. Like I believe you've messaged me before. So you just send me a message. If you've messaged me before, just send me a reminder. Then this time around, I'm going to save your number. Then try and see if she can tell me the name of the hospital. Then you can also go to that hospital to get your IVF done. All right. So Akim Godosen, when you're going to put out more videos, we have shot a lot of videos. I shot some videos today. So you're going to be expecting more videos from us. You're going to be getting more videos from us. Today we uploaded a video. Day before yesterday, we uploaded a video on how to conceive a male child. Okay. So all you need to do is to go to our YouTube channel and watch these videos. So you're going to be getting a lot of videos from us. We're trying to be very consistent this year. Yeah. You're going to be getting a lot of videos from us, hopefully daily. But for the now, we can only work with alternate days. So upload today, tomorrow, no uploads. Like alternate days upload. That's what I can work on for the now. So when I get stronger, I am going to work on everyday video so that I can take as much questions as I can. So that's it for the now. So Amazing Grace said, I don't have your number. I don't have your number. Okay, I'm going to see if I can type my number. Let me go live and type my number. You have to send me a message through my Nigeria line. Which is, I'm just going to type it. Let's see if I can type it here. +234 812371910. Let's see if it's going to. Okay, I think, yeah. So that's That number you see on the screen, Tony and Messi, just click on it. That's my number. So you can give me, you can send a message on WhatsApp. I might not reply on, I might not reply tonight because after the live video, I am going to have my night duty with my child. They are more awake at night. So I might not be able to reply tonight, but I'll try and contact the woman, then let you know. Okay. So we have William said, "Oh Lord Jesus Christ, mercy, speak for my womb. Going to fertility doctor for 3 years now. No baby. IUI failed 2 years ago in Detroit. Me need mercy on my womb fire." Oh, I like they say, let me tell you something. You don't know how, like, it's only those that wear the shoes that really know how it hurts. So Tanganisia Williams, I hope your prayer requests get answered, and I hope you carry your baby, and I hope you celebrate this year. Okay. So just keep pushing. Go for IUI, go for the fertility treatment that your doctors are going to advise if you have the financial capacity to do it. And I pray and hope that it comes out successful and you hear the cry of the baby in your house. Okay. I I transfer the baton to you. Like, yeah. And I wish you all the very best. I wish you the very best when it comes to your fertility journey. Sincerely, I wish you the very best. And I pray you carry your baby as soon as possible. Because sometimes it's easy to give advice. It's more easy to say, "Oh, wait on the Lord." It's more easy to say, "Oh, you don't have to bother." It's easy to dish those advice. But when it comes to you wearing the shoes, you are the only one that understand what you're passing through as a woman looking for the fruit of the womb. Nobody understands the pain better than you. So I don't understand the pain better than you, but I hope and pray that you carry your child safely. That is my hope. That's my prayer for you. Taganika. Okay. So Amazing Grace, I've typed the number on the screen so you can contact the number. Then I'll try as much as possible to attend to you. So Steve Ford said, do they give IVF to a woman who is 50 years old there? Where is it in Nigeria? They may try, but the fact is the chances of getting pregnant actually decreases with age. So even the chances for IVF, for IU decreases with age. So they all definitely going to decrease with age, but it's going to be like they are going to try. But the earlier you do this, the better for you. I don't know about 50 years of age, but I believe they can. They will want to give it a try if they are able to stimulate the woman's ovary to produce egg. So if the woman still has a lot of eggs, I think they might want to try. But at 50 years, this woman might be seeing her menopause, might be in a menopausal stage, might not be able to have enough eggs. But I think with science, they might be able to see what they can do to stimulate the woman to release eggs to help with fertility and pregnancy. A woman of 35, yes, sure, sure, sure. A woman of 35 can do IVF. Yeah, yeah. The earlier you do it, the better. The earlier you do your fertility treatment, the better. Like I was discussing with someone recently, and she had PCOS, which is polycystic ovary syndrome. She noticed that she had PCOS at a very, very tender age, at the age of 16. She noticed that her menses was not regular at the age of 16. So her mom actually followed up. So immediately she got pregnant, she started her fertility treatment and she got pregnant with no stress. And she's having a third baby soon. So one thing about fertility is that when you start the follow-up on time, when you start fertility treatment on time, there's an increased chances of it not affecting you, especially when you have PCOS and this. If you know you want to give birth and you start this fertility treatment on time, it's very easy. You get, but if you don't start it on time, you're waiting, oh, I want to give it a try 2 years, 3 years, 4 years. That's where the problem lies. So if you notice that as a woman, your menses is not regular, your cycle is not regular, you are having, it's better way to see the doctor. First of all, when you notice, oh, you are seeing your menses every 2 months, every 3 months, every 4 months, speak with your doctor. It's not something you keep to yourself. Speak to your doctor as soon as possible. Let them get this thing diagnosed. So when this thing is being diagnosed, they will know what is happening and what line of treatment you can take to actually give birth on time. So if they notice, they start treating on time, you get married or you get pregnant. So everything tends to go well on time. But if you keep waiting, that's where the problem lies. So fertility treatment works when it started on time. So amazingly said, what about the ones in Lagos? I have no idea about fertility treatment in Lagos, but I think there is a particular YouTuber that she's a fertility expert. I'm going to check on her, then get back to you. What I want to do is that, Grace, just try as much as possible to keep in touch. Even if I don't reply you as soon as possible, try as much as possible to keep in touch. I would like to help. So I know of a particular YouTuber that we communicate once in a blue moon. She's a doctor, like a fertility expert. So we can contact her and see how she's able to help with the fertility treatment and all that. Okay. But just try and keep in touch. I'll try my best to communicate with her to see what we can do to help with the apps. Because I know somebody contacted me and she was more interested in the one in Edo State, which is in Urumi, but I lost contact with her. I was unable to communicate with her effectively well. So what I would advise you to do is to try as much as possible to keep in contact. I'll try to send an email across to her and see if she's going to respond. So when she responds and tell me what it entails, then I'm going to refer you to her to see how it goes with the fertility treatment in Lagos. But one thing I will always say is that starting the fertility treatment is very important. Okay. I know some people will be wondering, I'm looking at one side of the camera more often. I'm both live on Facebook and on YouTube. So that's why my eyes are practically on the YouTube, because most of the questions I'm getting are on YouTube and not on Facebook. So that's why my eyes are just on this YouTube part, essentially. But I can see all of you. Layo Hester, Layo, how are you doing? Ugozi Oraka, how are you doing? Maris, how are you doing? Trust you all are doing great. It's an amazing time to be live. So we hope to come live more often. So this is just like an awakening live to tell people that we are back and they should expect us more from live, and they should also expect more videos from us. Okay. I think while I was pregnant, I could not even sit for long to do my live videos. Like it was really that bad. I was having like back pain, severe back pain. So I actually made a video on pregnancy support beds. Built. So that video is going to be coming up soon. So Amazing Grace said, can you briefly explain IVF? So I'm going to let me talk about IVF on this particular live video. So the full meaning of IVF is simply in vitro fertilization. IVF simply means in vitro fertilization. What is happening in an IVF is that we're going to be needing a sperm and we're going to be needing an egg. So with an egg alone, you can't get a baby with an IVF. So they take the egg from the woman's body and they take the sperm from the man. Most times this man has to masturbate to get the sperm out. So that's it. So, but before all these things are done, the woman has to they have to give some drugs, they have to do some tests. They don't just come and say, okay, today bring your egg, bring your sperm. No, they have to do some series of tests. They have to do some series of examination. They have to give you some medications to help stimulate your ovaries. They have to do a lot of history taking, medical history taking, surgical history taking to get the history. So when these things have been taken, they take the woman's egg, they harvest it. It's like harvesting maize. So they harvest the eggs, then they harvest the man's sperm too. Then they fertilize the baby outside the womb. You know, normally when you have sex, the fertilization takes place in the womb. But in such cases of an IVF, the fertilization is womb. The fertilization takes place outside the woman's womb. So when the fertilization is done outside the woman's womb, they've got to a particular stage, they take it away and put it in, that's the growing baby now. They take it and put it in the woman's womb. But they don't just do that. A lot of preparation goes in, a lot of things goes into preparation. Yeah, a lot of things goes into preparation. So they take it and put it back in the woman. Then the baby starts growing from there. Then when it gets to the time, depending on when contraction starts, and also depending on when the elective cesarean section, because they usually do elective CS for these people. So depending on when the elective cesarean section starts, then they go ahead. So it's for surrogacy to even take place, they use IVF. For surrogacy, you see people doing surrogacy. For surrogacy to take place is IVF, in vitro fertilization, that is being used for surrogacy to take place. So I just hope I've been able to give you like a summary of what an IVF entails. It's like a more detailed video is going to explain IVF in general, but there's like a summary of what IVF entails. Sharon said, Nurse, is there any treatment for varicose vein in the leg? Is it true that if you have veins problem, also you can have heart problem? So depending on the type of the veins that has been affected, it can also affect the heart. Okay, so depending on the type of the vein. So generally, when it comes to varicose vein, in UK here, they do a surgery, like a very little surgery, not really like a serious surgery to help with the varicose veins. I've answered your question, Amazing Grace. Like you were not online when I was talking about IVF. Maybe after the video, you play it again. I've answered the IVF questions. Yeah. So they do a day surgery. That surgery, you come that same day and go home that same day to actually help take away the varicose vein, clear the place and make it easy for it to go. So it depends on the type of vein that has that varicose, it can affect the heart. But generally, when you have that, it's usually not, I don't think it's a matter of concern, but I will have to research about that. Sorry, Sharon, I am unable to give you a definite answer for that varicose veins in the leg. So yeah, I think it's something I have to research about and find out more about varicose vein and heart problems. Then when I am able to get that, then I should be able to answer your questions. So what I'm going to do is to type your questions on my phone, then shoot a video on it. Sorry. Miss. Okay, let me just type it in my personal diary here. What's the second one? I can't find the second question. I've answered your first question, briefly explain. Can you type the second question again? Please just type the second question again, then I'll take it. Varicose vein and heart disease. I think I should screenshot, so that gives me an evidence to... Yeah, I've screenshot it. Let's do it this way. Okay, I'll screenshot your question, so expect a video on that. So I'll just read about it, then come make a video, then let you know the varicose vein and heart disease, okay? So that's for that. Amazing Grace, I didn't see your second question. I will appreciate if you type the second question again, so it's going to be much easier. So I think I'll be ending the live soon because we don't really have a lot of people on live, and also we don't have much questions today. So I might end the live soon. Yeah, so we can have more discussions over time. I can actually clear my studio because when I end the live, I still need time to clear my studio, clean up my makeup, and get things sorted out. Okay, so this is just like a reminder video that we are still available for you. We've not gone anywhere. We're back after childbirth and we are here for you at Nurses Lecture Room. Okay, it is what it is. It is what it is. Oh. So okay, Amazing Grace TV said our inbox it is like YouTube removed it. Okay, probably YouTube removed the question. When you send it on my inbox, like I earlier said, I might not reply that message on time, but that doesn't mean I don't want to reply you because I have a lot of my decks and messages are usually very voluminous. But for you, I'm going to try as much as possible to respond, send an email, and get things sorted out for you so we can get the best available IVF centers for you to get your IVF done. Okay, so that's practically what I have to say. All right, Amazing Grace. I've seen your message on my phone. I've seen it now. So I'll save your number, then send an email across to the fertility doctor in Lagos and see what they have to say. So my response is going to be determined by how soon she replies my email. So immediately she replies the email, I'm going to get inside. Hello, All Things Kids Hub. Thank you very much for joining our live. How are you doing? And trust you're doing great. I know you are doing great because I had a conversation with you today. So All Things Kids Hub, I know you are doing excellently well. I know you're doing extremely well. So that's that. Like I said, Gordon said, Nurse, what kind of work you do? So that's the kind of work I do. I'm a registered nurse, I'm a registered midwife, but I work in a theater. Yeah. I work in a theater as an anesthetic and recovery practitioner. So that's what I do. But for the now, I'm on a 1 year maternity leave. So I am only showing myself online to answer as much questions as I'm able to answer. All right. So that's what I am doing for the now. So for the now, I'm not working in the hospital for the next couple of months. Let's say 9, 10, 11 months. I will not be working in the hospital because I am on maternity leave. But after the maternity leave, I go back to my theater work. So that's what I do. So that is pretty it for today. I think we've tried for today. We've been live for up to like more than 30 minutes. That is actually a good one. That's actually a good one. And if there is no question, please, if you're watching this video, you're on live, be it YouTube or Facebook, and you've not clicked on the like button there, what are you waiting for? What are you practically waiting for? If you've not clicked on the like button, tell me, what are you waiting for? Why have you refused to click? And to click on the like button on YouTube, all you just have to do is to double tap the screen. You don't necessarily have to like go, just double tap the screen. Tap the screen, tap twice. Just click on your fingers and you've liked the video. So you don't have to do anything voluminous. You can see people are liking. So just double tap the screen, you like the video, and that shows you appreciate us. Okay. We are not asking for stars, we are not asking for anything. Just double tap the screen, just double like the video. Okay. So that's all for tonight. So I have like 20 minutes to get this place cleared up, clean up my makeup. Yeah. And go do my mommy duty. Bye, everyone, and see you in our next live. Hoping to be seeing a lot of those beautiful faces as time goes on. I love you all. Thank you very much for supporting the brand. Thank you very much for trusting us with your questions and your secrets. Good night, Stephen Ford, and good night, everybody. See you in our next live, hopefully tomorrow or as soon as we can.